Folks, welcome to Politics Done Right. My name is Egberto Willies, your host. We are going to have a great show for you today. In the studio, just leaving now, is the one and only Rourke. But you know what, man? We have a new show that we got to get started now. As he goes home, hey, Rourke, make sure to at least listen to the first 5 minutes now. Anyway, we're going to have a great time here. The manager is in the studio as well. I want to look, he's been doing a great job getting this place back up. So let's reward that great job by making sure he has the resources to work with. If he has the resources to work with, we can give you a great, I want to say product, but that sounds too much like a commercial thing. We can give you great value. We can give you great music. We can give you great talk. We can give you great Howard, who is one of the guys that are keeping us alive out here. Howard, get to the mic. How you doing, Howard? How are you doing, sir? Thank you for all you're doing out here, buddy. Tell folks why they need to really support this station, my brother.
Thank you, Egberto. It's a pleasure to come in here every day. It's a pleasure to work with you too.
Well, man.
To give us your support, 713
526 5738.
You see how fried I am.
Hey, look, you see, we've been working Howard so hard that his memory started to go, man.
I don't know whether I'm coming or going.
I tell you, man. Anyway, but we got to get a good fun drive here in this next hour. Sandy, get to the mic. Sandy, manager man, get to the mic. Sandy, how you doing today, sir? How are you doing? Look, he's running to the mic. I got him off guard for a change.
How I'm doing is good, but that's not a reflection of how well we're doing this morning on our fun drive. By far our most successful morning of the drive being the final day. It's a good time to do that final weekday. It's a good time to do that. I want to thank everybody stepping up. Please keep these donations coming. We're getting very close to the $124,000 mark. We're trying to make $150 by Sunday night. So if everybody could kind of send in their donations now, maybe by Sunday night we will be there and Marquisha's calculation will just not matter.
You know what?
That would be a really
Sandy, I don't like that word maybe. We're going to do it. Let's say it.
There it is. We're going to do it.
We're going to do it. We're going to make things happen. Yeah. And you know what? I don't mind being wrong on the low side, meaning we're going to make more than the 150. I am happy. Folks, call 713-526-5738. We have a great activist in the studio right now who just got here. Cathy Courtney, a very hard worker for all those folks that are on Medicare and that are needing to find out what Medicare Advantage means, etc. I tell you, why do you need to support us? Because we bring you the value. We bring you what's right for you. 713-526-5738, extension numero uno. Extension numero uno. Anyway, folks, Cathy comes into the studio and Cathy comes with her sign that she's always out there showing folks. I spoke to her a couple nights ago and she said, Egberto, you know what? People are calling me. They're taking on Medicare Advantage and they don't exactly know what's going on. They're taking Medicare. I have had to do this. I have had to do all of this. So you know what I'm going to do? I'm going to tell the rest of the world, Cathy, come and sit down, my dear, beautiful lady. We are ready to go. I want to thank you for coming into the studio. You are such a hard worker. Such a hard worker. Have a seat, my dear lady. Have a seat. Yeah, that's okay. Oh, I'm sorry. Okay, great. Let me tell you, folks, I wanted this lady here for one reason. We were at a Houston Peace and Justice meeting. And at that meeting, I said to her, look, that information that you're given here, you need to tell the rest of Houston. Tell your audience hi. How are you doing today?
Hi.
This is Mike here.
Hello. Howdy. Do you notice what I have on today?
You are always dressed with some interesting paraphernalia. What does that one say?
Well, since I'm going out and about today and it's Go Texan Day, I thought I should wear my cowboy hat with the skull and crossbones.
Yeah.
Because then that reminds everybody, why are you doing that? And I got my vest and my buttons because it reminds everybody about the deaths in our U.S. healthcare system.
Yeah. Oh, say that again. It reminds us about what?
Death in our U.S. healthcare system.
Absolutely. So that is just about what we're living right now, isn't it, Cathy?
Is this too stark to wear this around?
No, it's not. Okay. It is not. Cathy Courtney. Cathy, before I get started, Tell me a little bit about yourself. What do you do?
I work with Healthcare for All Texas, which is the first single payer organization in Texas, founded in 2002. I've been a public and private healthcare worker.
And?
Oh, I just took off my hat.
That's okay. That's okay. We need to stay on air. Go ahead.
I've been a public and private healthcare worker in hospitals and clinics. I founded the first women-owned clinic in the state of Michigan, the Detroit Feminist Women's Health Center. I learned from American Public Health Association in 1973 at a conference about a national single-payer health plan. I went, oh, what a good idea.
Right.
And I've been following that, working with that, advocating for a single-payer and health justice in America ever since.
And you know, it's interesting because we were on the phone probably near midnight a couple days ago, and you were telling me about how many people you have to counsel because of what this system, folks, they just turned 65. They don't know what to do. And they find that they have tons of bills, and you've been able to get them some help. Tell us a little bit about the kind of stuff.
Well, I could go through a whole litany of healthcare problems, because that would take, it's like going to church.
Right.
You could just go through this happened, this happened, this happened, which we're not going to do. I don't have that much time. But I'm just going to say, write this down. Look up the American Health Empire, Power, Profits, and Politics. That's by Dr. Barbara Ehrenreich and husband John.
Right.
And everything that's bad about American medicine is especially bad if you're not male or white.
Right.
So the major problems that people are always worried about is, let's just start. How do you find a doctor? They call up and go, how do I find a doctor that's in a network? And where do I go for whatever problem? And how do you find it if it's offered at a reasonable price? And how do you figure out where to go? And what type of medical care do I need? This happened. The primary care said is this. Is it urology or neurology or nephrology? Sorry, I usually bang on things. I'm figuring out, they have to figure out when you get there, what are they doing to me? What is this for? What test? How much is this going to cost? And then how to get heard if things don't go right. Because sometimes it's overwhelmingly an institutionalized racism, sexism, and classism that people have to overcome. And so every week, some of us from Healthcare for All Texas, doctors, nurses, professionals, PT people, we talk to individuals.
You help people.
We do. We help them.
I want before you go further, I want you to specify that website, because there's a lot of people in Houston right now. They're not seeing their doctor. They're not seeing things that they need to get done because they are fearful of the system. They're fearful what this system is going to cost them. What you are able to do many times is tell them how to navigate this fairly evil system. You guys at HCFAT have found ways to help people. What's the website?
Healthcareforalltexas.org is a good website to go to. And our granddaddy organization, we're a subchapter of the Physicians for National Health
That's a
Program.
great organization.
Would you please look that up? I brought brochures for you and everybody on the station today. Oh, I'm rattling papers again.
Well, we'll do that after the show. You are you had a long frazzled ride here, so.
Well, that's because I'll hold your hand. Let me hold your hand a minute.
Yeah.
So I'm suited up, showed up, getting my stuff ready to come, and my niece calls. How do I do a GoFundMe? What do I do? There's another auntie who's got a rare form of multiple sclerosis, and there's not enough money. And but they're insured, but they're not really insured. They're underinsured,
right?
The majority of people. And how long can I talk to her? No, I got something else to do.
You're coming here.
I got something else to do right now. Coming here, but I'll call her later. And do you know that now? Over 60% of all the GoFundMe pages are for medical bills and related, because people can't pay it. They lose their homes. They mortgage their house. They go bankrupt. Medical bankruptcies are the number one
Cathy,
cause.
and this we have to start letting Americans know that this is not just a cliche that people constantly hear about, you going bankrupt, etc. I want to talk a little bit about that, but before I want to do a little pitch in here and say, folks, please give us a call at 713-526-5738. Again, that number is 713-526-5738. We need your calls now. We are not yet at our goal. As you can see, we have people coming into this studio who have answers. People coming into this studio who blow away what you see on TV that's not there telling the truth. We have the Cathy Courtneys of the city, of the country, to give us direction and help us navigate through something we should not have had to do. 713-526-5738. Hit option 1. We need your contributions. We need your support so that we can continue to do this job of letting folks know that you have a way out. You have a solution. KPFT is here for you. Cathy Courtney is here for you. Cathy, let's get to the basics now.
No, I want to add on.
Go ahead.
It's a PS to your fundraiser.
Okay.
Healthcare for All Texas, since we've been working since 2002, every second Thursday, we have a meeting from 6:30 to 8. Can't do it in person since COVID time, so it's on Zoom. So if you're at the website or you write me or you write info@hcfat.org, or you can go on Facebook and see our page there, and you can say, send me the info. I want to join in because I got a story to tell or I want to do something. But we have supported Fund Drive before, and we've been here back when we called it manning the phones.
You can't say that anymore.
No.
Yeah.
And I said, obviously you don't want me to come. but we would staff the phones, and so I have pictures, which I could send you. But we should do a collage because we answer the phones and we make the pitch. So for those of you who are involved with Healthcare for All Texas, who are listening today, or Cover Texas Now, or National Nurses United, or My Medicaid Matters, or people with disabilities, or the people who are planning a rally like next week in Senate District 07, wherever you are, if you're a healthcare supporter, I want you to contribute because this is our only community radio station, and you don't get to hear about profiteers and oligarchs who control our system on any other mainstream media.
And that's why we love you, girl. That's why we love you, because you're out there covering every facet of what we do out here. Now, let's start about, you and I had a discussion about Medicare Advantage, and you told me a little bit about your story that kind of brought tears to your eyes about what they put you through as far as having to, why don't you relay that story if at all possible? If you want, you don't have to, but if you're inclined to.
Other people can relate, I'm sure. I was one of 28,000 people in Houston, and people who worked for, those of you who are out there, you worked at the school district, you worked for the city, the county. We took whatever health insurance plan was given to us, Cigna, Anthem, Blue Cross, whatever, your municipality had contracted with, negotiated with on behalf of employers. Most people who get employer health insurance, it used to be the majority of Americans. It's gone down now to 67%, now 60%. So many employers don't give it at all, and they make the employee pay everything. And so I always tell the young people, that's like your second question. Thank you for hiring me, but and what part of my health insurance do you cover, and what do I have to do? Go ahead.
No, you go. I'm listening to you. Continue.
So when I received written notice from Kelsey Siebold, which is one of the largest provider networks in the state, I started when the campus was built on Holcomb, the main campus.
I remember that campus, yes.
So just imagine years later, after you've been there for a while, and all your doctors and your baby's there, and your pediatric, and your husband's on your plan, and all this stuff, they gave notice. 28,000 of us got told. It's like I'll summarize it. When I talked to billing and I wrote to corporate to say, it's like a gun to my head. You're saying, you can't come here anymore unless you sign up for our KCA, Kelsey Care Advantage, our Medicare Advantage. It'll be a big advantage to you. Yeah, it's a big advantage to us, but I don't want to come here. Well, then you can't come to any of the Kelsey-Siebold networks anymore. All those providers, 600 some providers, 14 different, now there's 30 different clinics all over. That's ridiculous and oppressive and exploitive. So I would like the media, if there's a media person out there, somebody needs to follow up. What the hell ever happened to all those people? Because I said, okay, hands up. I'll take it because all my stuff is here and I get scolded by my leftier than thou friends. I got a left. I'm pretty lefty, but there's leftier than thou, friends. You should never sign up for Medicare Advantage.
I want to stop you there now because I want to speak directly to a lot of folks that you had to involve yourself in. But before I want to say, we got a new member, James and Gwen. Thank you so kindly for being a new supporter of our station. Thank you so kindly for being here. Folks, we need a lot more to call in. 713-526-5738. Again, that number is 713-526-5738. Hit option number 1. Cathy was mentioning that she was forced, because of all her doctors being, in this case, at Kelsey, that she was forced into adapting a Medicare Advantage plan in as much as she did not want to change plans. She didn't want to. So because all of her doctors were in that system, they pretty much coerced her. They extorted her to say, if you want to continue coming here, you must join this MA program, this Medicare Advantage program. Let me summarize a bit here. Because she is an activist, because she understands that the best thing is for us to maintain real Medicare and not Medicare Advantage, she had to take it. And then many of her activist friends were saying, scolding her, shaming, and saying, why did you do that? You went against the protocol. You went against policy. You went ahead and adapted to what the man said after all. To which my message to all of us, lefties, righties, and the others, I'm going to tell you guys something. Right now in Houston, there are some people who their only avenue to health care is going to be, in fact, Medicare Advantage because of the corrupt system that we have. I want to qualify this. No one should feel any shame. No one should feel any bad thoughts if they had to do it. But here's the message I want to get across to you, and then I'll bring Cathy in. If you have the option not to take Medicare Advantage, even if it costs you a few more bucks, those would be well spent. I'm going to give an example here, folks. I can get Allstate insurance. I can get some other kind of insurance. But if I know that some other kind of insurance costs me all that I can afford, and Allstate costs me just a little bit more that I can't afford, for the sake of my family, I must go with what I can afford. But I must then work with the Cathys of Houston, with all the other Medicare folks and activists around that are saying, we don't need any of this crap. What we need is a healthcare system that works for all of us. Not that, well, if I can afford this, I'll have to go with Medicare Advantage. I want to read, I didn't give you guys the start of the program that I sent in the newsletter today because given that I was going to have you on, Cathy, I wanted to make people understand what we're talking about. The title of this part of the show was Healthcare Activist Cathy Courtney Speaks on Medicare Advantage, Moderna's Record Profit Shame. We're not going to go into Moderna right now. The healthcare industrial complex, specifically the health insurance industry, has been methodically undermining your healthcare costs and your health with smoke and mirrors. They're saving millions of Americans money in the short term as they drain the real Medicare coffers by privatizing Medicare on the sly with their misleading named product. Medicare Advantage, it is not Medicare. It is a private insurance that must make a profit for its shareholders and big bonuses for the executives who run it on the backs of taxpayers. Unfortunately, those health insurance companies do not only work on fooling Americans, they pay off many in our government to ensure it does not provide Americans with the necessary care. Why does Medicare Advantage provide eyes, dental, and hearing care while standard Medicare does not, unless you purchase a rider? Mm-hmm. The health insurance industry bribes your Washington politicians via their lobbyists and campaign contributions not to make that a part of standard Medicare. Senator Bernie Sanders continues his attempts to get those services as a standard part of Medicare, but too many politicians are on the take. That is why we must elect the progressive that will give all Americans a better life with human-centered policies that benefit us all instead of corporate-centered policies that only benefit a few. Cathy Courtney is a valiant activist who helps people throughout the country navigate our fraudulent healthcare system, whether they are trapped in Medicare Advantage or trapped in bills they are unable to afford. She knows we have a lot of work to do, and she is doing her part, not only in bringing awareness to the issue, but helping those trapped by it. What can you do who are listening to me right now, my brothers and sisters? First of all, you can make sure that Cathy can continue doing her work. You can make sure that KPFT can start featuring people like Cathy to do and get the work done. 713-526-5738, extension number 1. We could use all the support that you can give right now to keep us on air. We cannot survive without you. Cathy?
A lot of people don't know the difference between traditional public Medicare and privatized Medicare Advantage. Write this down, people. We don't call it Medicare Advantage anymore. We call it Medicare Disadvantage. Mm-hmm. And so people say, you think that's ever going to happen in this country? It's going to be socialized medicine? No, we're not going to be like the National Health Services in England or in China or in Cuba. It's going to be a uniquely American plan. And we've already got a public insurance program. It took, before you say, that doom and gloom and you're all pessimistic, it's never going to happen. Yeah, it is. Social change takes time.
Exactly right.
It took the first president, we'll go way back to Harry Truman, Best Truman, after World War I, every other major industrialized country and had some kind of national health plan after that because they got soldiers coming back and people need health care and the seniors. But it took 22 years every year in Congress to get enough Congress people before LBJ could sign on to the Civil Rights Act and to the Medicare and Medicaid Act. And in his personal papers, you should go see the library someday. He said, we're going to lose the Democrats because I'm going to sign it.
Johnson said it, yep.
But we're going to lose the South to those Dixiecrats and those racist people and those because they don't want the colors to get it. And that's deep racism.
Yeah.
It took
to hurt yourself so that we can't all have the right kind of policies.
And there's a couple of films about Fix-It healthcare system.
Very important film. Tell us about it.
I'm just going to write it down. Fixit.com. Look it up on Google. There's a new film that's come out by the same people that's called The American Hospitals, Healing a Broken System. And I really want listeners, if you go to a church, school, a club, we think Shape Community Center may be the co-host with Healthcare for All Texas, Houston Peace and Justice Center, Green Party. We're looking for co-sponsors. Bring the film here, have the first showing so people can see what it was like. You know that Medicare pretty much integrated hospital systems and healthcare in the United States.
No, they wouldn't pay unless the hospitals would allow everybody healthcare. Absolutely.
Right. And they called it the colored wards, the Negro wards, whatever. But eventually they had to give in if they wanted their money because they got people in the hospital.
It's always about the green. And the funny thing about it is all the evils that we have in society today always have its genesis in money.
Yes.
In money. And they use it to bend our minds. 713-526-5738. We are still slow on those calls. Folks, as you all know, we cannot do this without you. We have Cathy Courtney in the house with us today. Cathy is a Medicare activist, a healthcare for all activist, a Medicare for all activist. We need to ensure, if we want change in this country, if we honestly, you're sitting back there right now, if we really, really, really want change, those of us who have the wherewithal to support change, we have to be a part of it. And how do we do that? We ensure that the KPFTs are alive. We ensure that we are the avenue. We are the tool. We are the medium that the Cathy Courtneys and many other folks who are trying to give us a better life throughout this country. We are that medium that allows that to occur, my brothers and sisters.
Come on, you Healthcare for All Texas, you nurses, you doctors, you people who work in the hospitals. Listen up and call in and say, I'm calling in for Healthcare for All and supporting a community radio station. Come on, call in.
713-526-5738, extension number 1. I know many of you want to call in, but you know that Cathy has a lot of stuff to say, and you don't want to miss what she's saying. Well, I'm going to be pitching for the next 3 or 4 minutes, okay? So what I'm going to ask you for the next 3 minutes or so is go ahead and make that call now. You're not going to lose anything. 713-526-5738. Bridge MCP is on the internet, and she says, I agree. However, I have learned some states won't take other insurance. Like my brother's insurance was rejected when he moved to North Carolina. He had to change and loves Medicare Advantage. No cost taken everywhere. You know, that is, and like I mentioned before, there are exceptions to the totality of what occurs, right? Like Cathy was talking about Kelsey Siebel here in Houston, right? They told her that she had to be on MA. They held, as she said, they held a gun to her head and said, you had to be at Medicare. Well, we're talking figuratively, folks, figuratively. And told her she had to be on Medicare Advantage. So, Bridge, I get it. Please tell my comment above and ask her. That is exactly what I don't know how early on you came on, but that is what happened to you pretty much.
Yes, and please write this out. Besides just calling and complaining here, please write it out, describe the situation, write to the insurance company, write to the provider, write to your city and your county and your state legislator and your congressperson. They need to hear from constituents that these problems are real, that you are the real human with this real problem, and what are they doing about it? Exactly
right. Look, we have somebody in the chat also says, get some new members. We need new members. Call in. If you've never called in before, call in with a $40 pledge, irrespective of how long it takes you to pay. $40 pledge, you can do it over time. Okay, you can do it over time. So $4 a month, $3 a month. I don't recall what it turns out to be. $3 something a month. And if you do that, your funds are being matched. It's being matched, okay? We need your support for what we're doing here.
Who's doing the matching?
I can't give the name. He won't allow me to reveal the name, but he said anybody that's a new member that gives 40 or more, he's matching.
Oh, bless him. All right, go.
Yes. So, folks, 713-526-5738. Give us a call, 713-526-5738. We have Cathy with us in the house. Like I said, I was on the phone late, midnight, 2 days ago. I thought I was the only insomniac around here. It seems like Cathy...
No, it was only 11:15 p.m.
It was only 11:15 p.m. Are you sure?
Yeah, I'm sure.
Okay, well, whatever the time it was, but I still think you're insomniac. Let's go to Chris Micah. Hey, Brother Micah, how are you doing, sir?
Hey, Egberto, how are you?
I am fine. Talk to me.
From Netroots.
Yes, do you think I want to forget a Chris Micah from Netroots? Come on, man.
No.
What's going on, my brother?
I just tuned in, and I don't know whether that's been asked or not.
Okay.
But, reaching that age where I'm getting Medicare.
Solicitations.
So, that's the thing, is like, what? I just seem to be a target for scams through the mail.
Yes, you are.
Scams on the internet. I need this and that and the other thing. How do we make this stop?
You can't at this point unless we stop the program under the Centers for Medicare Services, the CMS. Trump expanded the CMS and put a whole new unit in 2016. Write this down. Look up on Healthcare for All Texas and Physicians for a National Health Program. Just type in Medicare Advantage schemes. Also, Andy Haley, who's a longtime Democrat.
He's right here in Houston, yeah.
He's in Houston. He told his personal story. He called me up, listen to this. And so he's going in to sign up and redo stuff. And in the fine print, it just tricks him. He says, no, this is trickery. It's like a scheme. I'm not giving permission. Well, you have to sign this, and we're going to move you over. Providers are angry because they're getting moved over. And patients, nurses, staffing, all those people. So, but you need to write it down, look it up, document it. And I'm going to ask you to, all those solicitations that y'all are getting in the mail, some of us have been throwing them into one garbage bag because someday we're going to have a big burn pile. Well, I don't want to get busted for littering, so we can't do that. But we could have a big pile and a demonstration and a protest at one of the big insurance companies around here. I can just visualize it. Can't you see a mound of trash, all that wasted and burnt and killed dead trees that we're getting in the mail and the scam phone calls? And we have a little rep that you can start giving back. Like when the last one calls me, well, Miss Courtney, you need to change again. You have the opportunity to go, listen, I know, honey, you have to have a job. I'm glad you have a job. I appreciate that. But I'm never going to sign up for another Medicare Advantage program, which is profiteering, owned by oligarchs and hedge funds and investment companies. And they charge us and cost more money than Medicare does.
They actually make a profit from not giving you service. Always remember that these private companies, their profit is what they don't serve you in the healthcare. Let me tell you, Chris, I met you this last summer at Netroots Nation. Let me tell you something, my brother. This is important. If you can afford to get standard Medicare and the riders for your ears, eyes, and hearing, do it.
Please.
Because you are part of what's going to save the system that allows us to then move to healthcare for all. I
need it for my teeth.
Say that again?
I need it for my teeth.
There you go. I'm saying
I don't know how to do that. I try to find out. I've got to figure out how to do that.
You go. Tell her.
Okay, one of the ways is you can go online on Facebook. Are you on Facebook, social media? No?
Yes.
Okay.
I'm looking at you right now there. I'm waving to you.
Oh. All right. We are waving to you too. Okay.
So you want to be able to, you can call dental providers to say, will you take the prevailing rate that Medicaid pays? But most of them won't. There's a lot of doctors and dentists that don't go, because the poor people can only go to Medicaid. But when you're a senior, you can get Medicare plus Medicaid. Also, Harris Health System. That's our Harris County Hospital District, charitable district system that your tax dollars and your...
Now, Mike, I think, is in Pennsylvania, right? Or D.C.? D.C.
Where are you?
Yeah, I'm in Virginia, so I'm right.
Virginia.
So there's a Virginia. There's a single-payer group in your state as well as one in everywhere. And Physicians for a National Health Program has a chapter. So you can go look on it.
But the thing here, Chris, is that there are solutions. Don't jump the gun. And that's right. British MCP just reminded me, when I had some dental issues and needed an extraction, I went to the dental school from my university, University of Texas.
Yes.
That is another option. And in Virginia, you all have some great universities with dental schools. Those are the different options that you have. But the thing that we have to try to stress to people, if at all possible, we need folks to stay away from the Medicare Advantage fund. And I repeat, if you are there already, we understand there's no shame, no nothing out of there. It's a system. What we do to fight the system, however, is those of us who can prevent from getting in there, we do it. But secondly, and most importantly, if you are healthy and you were thrown into that system by corrupt manners, the first chance you get to get out of it, get out of it.
That's correct.
And you will still be able to afford Medigap. Go ahead, sir.
The other thing is, Cathy, I'm sure you know Eric Larson.
Yes, go ahead.
You guys should work together on this whole thing of Medicare Advantage, and I'm sure you probably already do.
He's in there's a national coalition. This is a flashback. I'm glad that you're there, and would you please document what you're going through, and you send it and call your city council or your commissioner, and you say, this is my problem, because you're going to make it their problem too.
Bridget, thank you so kindly for your support. Bridget just sent in a support for our politics done right here at KPFT. Woo-hoo! We thank you so kindly for your support. Folks, we still need a lot more. 713-526-5738. Bridge, you are a voting member on Pacifica Network with your contribution, and so is James and Gwen Pulaski. We need a lot more to call in. 713-526-5738. Go ahead. Get ahead, Chris. Chris. Are you there, Chris? Go ahead.
Yeah. Oh,
Can't hear you. He's gone.
All right. I'm sorry. Call back, Chris, and we'll get you on. Anyhow, folks, 713-526-5738. Bridge MCP says should be persuasive barrier, but ears, eyes, and teeth, the things that getting older and purpose. All right, I couldn't read that one so well on the screen, but thank you. We have a lot of following right now on watching this program. Folks, in as much as you're watching, we need you to call in. Go ahead. You want to say something? Go ahead. Our manager wants to come in.
Just want to thank everybody that it's called this morning. It's kind of slowed down a little bit over lunchtime here. We're taking a little breather, myself included. But I want to remind you, this is the last weekday of Fund Drive, the last chance to support politics done right. And if your favorite show went by already this drive this week, it's okay. It's Amnesty Day. It's Go Texan Day. Come on, the cook-off starts tonight. Let's start cooking here today so that by Sunday night, the brisket is cooked. 713-526-5738, option 1, or kpft.org. Thank you.
Absolutely. Thank you very much, Sandy. Let's go ahead and get Alistair on the air. Alistair, come on in. Alistair Waters. Let's see. I think they're going to hit it right now. Alistair Waters, you're on, Alistair. Come on in.
Am I on now?
You're on now, my dear beautiful lady.
Awesome. Hey, brother.
How you doing, sis?
So, I am doing all right today. But I wanted to talk about there was a problem. So I am disabled, so I received Medicare after waiting a couple of years after receiving disability. You have to wait. There's a timeline that you have to wait. So I was not given an option. I am definitely not of age to retire near or any of that. So I was not given an option but to take either Medicare and not have any prescription coverage, nothing added on.
Right.
Or sign up for Medicare Advantage.
Right. I
have different things.
Let me tell you.
I just wanted to know who do we need to talk to make it so that, younger people that receive disability have a choice to sign up for Medigap.
They need to be able to.
At least in Texas.
Right. No, this is getting worse in Texas, too. It used to be traditional Medicare. The bulk of us were on that, seniors and people with disabilities. And then when, especially during Trump, in 2016, that administration, they instituted a little-known federal agency. Look this up, Centers for Medicare and Medicaid Innovation. And they hired Elizabeth Fowler, who is a former WellPoint, Anthem,
insurance
agent.
An insurance.
Right. Who helped actually write the ACA, the Affordable Care Act, to make sure that insurance companies would be in charge, not the public and not the federal government. And it's been increasingly moving enrollees, often without their consent, to these for-profit middlemen. Write this down. The new word is direct contracting entities, DCEs. You should have my cohort, Linda Phoenix, on here.
Actually, I had one of the experts on DCEs on as well.
Oh, yeah. Who was that?
I don't remember her name, but I'll let you know later.
So the big pitch is that this is going to save us money, and it's going to be supposedly greater efficiency, but it actually adds to the cost of coverage by taking their own cut of profits. So, but you need to document it, write it. Andy Haley did a whole write-up on it, wrote it his city, his county, his state, the Congress, got onto Medium. He went public and national with it. Yeah. And that really helps a lot of people.
You have to do it. Look, Cathy, Alistair, we accidentally dropped you. Sorry about that. If you need to tell me some more, call me back. Let's go to Andre. Come on, Andre. Come on in. So, Cathy, you can call back. Hear me, Cathy. You can call back, Alistair. We dropped you accidentally. Andre, come on in.
Yeah, okay. I'm here. You there?
Yes, sir.
Okay, got a quick question. I worked for a university in Texas here, and I got insurance, right? And they gave me insurance, and I forgot what it was. But anyway, so here I've got this insurance. Now I retired at 65. I got Medicare. Now I'm not sure if my state insurance they gave me extra insurance besides Medicare. But next thing I know, I had Medicare Advantage, PPO.
Yes, it's a trick. Yeah.
How does that work? And can I get away from this, or would it behoove me to keep it, or what?
You can also call your old HR rep wherever you worked at because I used to work at UT Health Science Center in the medical school also. Because if you call somebody local who's inside, if you call the insurance agent, they're just going to give you the runaround and just dog you. But if you call somebody who's on the inside, who knows what the different supplemental plan is, you're one of many. I'm sorry. There are thousands of TRS, the Texas Retirement System, those of us who were on that, whatever the TRS contracts with. I mean, you've been with Cigna, you've been with Anthem, but we've been with Blue Cross. I get that. So whatever it is now, it's the subcontract, that plan, they're in control. And we must stop this. There is going to be some legislation that we're trying to do to prevent any further privatization. This is critical right now. We're at a critical mass. It used to be, a few people. And when Trump got in, it went from 24% of the population within 4 short years, 31% of Americans on Medicare are now in a Medicare Advantage, and that costs us trillions of dollars.
Yes,
How much is they charging me for that? Excuse me, I'm sorry. How much are they charging me for the Advantage?
You don't pay because
it comes out of your
Social Security and the Medicare fund. But here's a problem. The people who are on Medicare Advantage are costing more money to the American taxpayer than the people who are on standard Medicare. And that is why the system is blowing up. That is why the system is blowing up. So what we are saying is the following, my dear brother, is the following, and this is important. Many of you who are already on Medicare Advantage, do the best you can with Medicare Advantage right now. But also support those of us who are fighting like hell. And I'm talking about the Cathy Courtneys of the world, who are really trying to educate folks so that we can get policy. We want Medicare Advantage gone. We want all this private sort of stuff Advantage gone so that we can have all our folks insured. Everybody insured with good health care. Look, our phones are filling up, and I got to go right now, Andrea, but thank you so kindly for calling.
Yeah.
Stay listening to this station because we are going to be covering a whole lot of this going forward. Cathy will be back as well, and we'll have many other folks back. Okay, my dear brother, go ahead.
I can't get one more plug in. Look up House Resolution 34. In the Congress, at least this week, Lloyd Doggett introduced
Wait. You are here till the end of the show. I wasn't trying to tell you that you're going, my dear friend.
Okay.
All right, let's go. Thank you very much, Andrea. Let's go ahead and go to Reginald. Come on in, Reginald. Let's see. They're about to get Reginald. There you go. You're in, Reginald.
I'm turning 65.
Yes.
I'm 64.
Yes, sir.
And before I jump into the wrong
plan,
something, I would like to talk to someone like Cathy that is aware of things that they could tell me. So I was kind of looking for her office.
Let me tell you what.
Number and everything.
Cathy, should I give him my email, or you have an email you can give him that he can send an email to you?
You can screen him. You take it.
Okay.
Because
let me tell you, Cathy, go ahead and send it to info@politicsdoneright.com and just tag Cathy Courtney in there so that I know that we spoke.
Just tag Medicare Advantage, because Egberto is a really good ally for health justice. He's been through personal health problems, the horror stories, his daughter. He knows this. He's been listening to us, which is why I support you. In fact, I'm going to award you a button today.
Well, thank you.
And what does the button say, Egberto?
This button says, single payer is health care equality for all. Thank you, my dear, beautiful lady. So, Reginald, send info@politicsdoneright.com. Info@politicsdoneright.com. And I promise you I'll return I'll email to you and give you whatever info we need. But you don't let them manhandle you, or you don't let them fool you. Okay, my brother?
And be cautious.
Right, that's what I want.
Be cautious with the navigators. There's a new system out there. They're calling themselves the patient navigators. That sounds good.
And they're just sending you to Medicare Advantage, pretty much.
Whatever contract, whatever investment company that they're with. So you got to find out what company you're trying to sell me to. What are you trying to hustle?
Okay, let me do a little pitch. Thank you very much. Send me the email. We'll talk, brother. Before I go to Wendy, I want to go ahead and do a little pitching. Folks, please, I ask you so kindly, as you can see, what we do here is we are trying to educate folks. We're trying to make sure people don't make the mistakes that many are making. Give us a call at 713-526-5738. Again, that number is 713-526-5738. And don't worry if you're going to miss a minute or two of the program. It only takes a minute to contribute. 1 minute when you call. You can also go to kpft.org and make sure to select Politics Done Right as the show you're supporting, but provide whatever support you can to make sure this station stays on air. This is supposed to be the last day of pitching on Politics Done Right, and starting on Monday, we should go to a full-fledged show where we take all the calls and talk to everybody. As usual, I ask you so kindly, una vez más, one more time, 713-526-5738. And let me tell you, for the Reginald who just called, I have a brother here on the internet that says, please connect me with him. This is what community sourcing does. I have somebody that I'm going to put you in touch with now, Reginald, as soon as I get that email from you. Wendy, come on in, Wendy. Great to see you here, Wendy. Let's see. Bring Wendy in. That is line number 3. Come on in, Wendy. Wendy, how are you doing?
I'm doing okay, and I just want to say first that I just got in my car, so I have no idea what your show's about, like if it's about single payer or if it's about Medicare and Medicare Advantage.
It's about all of that.
But I have my own. Yeah, okay. So my issue that I don't know if you've addressed is if you do go for Medicare Advantage, and I had one of those guys, by the way, I don't think he was a navigator exactly. There's different categories. There's brokers and there's navigators, but I think mine was a broker, and he really wasn't working for any one company, but he still couldn't quite understand why anybody would want to go for Medicare over Medicare Advantage when it covers so much more. And he would get his little cut anyway, no matter what. But so I don't think it was a profit-driven voter. I think I ended up kind of knowing more about the insurance than he did. But anyway, if you go to Medicare Advantage and you end up deciding you want to go back to original Medicare, I've been informed that there's a deal. You won't be able to get back into
Medigap, right.
The Medigap, right. So did you guys already cover that? I'm sorry.
Well, I spoke about that on... No. You're doing great. I covered that on many shows, and I also covered that in the initial thing that I said. But let me just tell everybody, because you brought it up. If you are on Medicare Advantage and you find out it's not working for you because of the doctors that you have in there, and you say, I want to go back to standard Medicare, you can go back to standard Medicare, but you'll have an issue getting Medigap, which covers that other 20% that Medicare doesn't cover. What usually happens is that it costs a bit more to get the Medigap. And if you're sick, you'll have to go back through reauthorization, which could make it completely prohibitive to go in. So that's why I tell people, if you have the wherewithal to start with Medicare, not Medicare Advantage, make sure you start with Medicare. No buts asked at all. Let's get Lee on the phone. Thank you very, very much, Wendy. We're running out of time, so I got to run. But thank you so kindly for call. Oh, we lost the call. Go on in, Lee, and call back. Yeah. Maggie, call back, please. Maggie, call back. All right, Lee, come on in.
I got a fast comment.
Yes.
73 years old.
Yes.
I've got Medicare only.
Yes.
Medicare only gives you the right to go to any doctor, anytime, any place. Commercial, Part C commercial, sends you to places where you get told, no, you can't go there.
Right.
No, you can't have this service.
Yes.
So it might cost me for my drugs. They're not bad so far. But I am very, very satisfied. I've had rotator cuff. I have had ablation surgery.
Right.
I've had carpal tunnel. I've got to go have something else done to my heart, and my cost out of pocket is squat.
Yeah, well, let me tell you also, there are a lot of other features as well, Lee, that include their good RX or drug RX or something like that you can use now that really cut your drug prices by 90% many times. So there are a lot of options that you can have not to go into Medicare Advantage. But what we are doing right now is we're fighting to get rid of everything, standard Medicare and Medicare Advantage, to give people what they really need, which is Medicare, which is health care for all. Anyway, thank you so kindly, Lee, and let's go to Maggie.
I got one.
Go ahead, Lee. Go ahead, real quick.
You mentioned good RX.
Yes.
That's not very good support. If you want a good program, Kroger's got one. They got a premium on it. It's like $35 a year.
Wow.
Walgreens has got similar, and you get a better deal than you do good RX.
Okay, Lee, let me just use you as a jump off. That is why we have KPFT, folks. You see, Lee calls in, and with those words that Lee's given on air for all of you to hear, we are able to promote this information to many. 713-526-5738. Hit option 1. Folks, we are really behind in the support. I know many of you want to listen to the show before you support, but this show is going to be on podcast as well that you can get online. Please call now. 713-526-5738. Let's go ahead and go to Maggie. Let's go to Nancy.
Thanks, bye.
Thank you very much, Lee. Nancy, come on line 2. Go ahead on line 2. Nancy, we're having some phone problems. Okay. Nancy, are you there? Nancy, are you there? Okay. All right. You wanted to say something.
I have two. We only have like 4 minutes.
Yes, real quick.
So I have 2 major points. People, there are numerous ways that you can help out. If you write me at info@HCA50, send me the what to do list and send your email. I can say how you can help, what you can do, because it's too long to talk about. That's a whole separate show. But write down House Resolution 34. Look up what Lloyd Doggett is promoting to Assuring Medicare's Promise Act. We need to amp it up, America. And because that's going to add $650 billion to our Medicare. If we would just tax the rich, the 1%ers, they could help cover what we need for Medicare for all right now. There's enough. Actually, the math wonks have done it. There's enough money.
We know that.
Everybody who's working, we can move to that.
Absolutely. Let's go to Nancy, line 1. Come on in, Nancy. Nancy, line 1. All right. There we go. Nancy, you're on.
Okay. Thank you. I'd like to say that we have 13 Democrats in the federal House, in the U.S. House.
Yes.
Only 5 of them have signed up to H.R. 1976, Medicare for all residents from birth.
Yes.
This is what we want. This is what we want. Al Green, thank you. Lloyd Doggett, thank you. Veronica Escobar, thank you. And Sheila Jackson Lee and Mark Vesey, thank you. Now, what I would like people to pay attention, there are around 8 other Democrats that have not signed it. And 2 of them are in hometown of Houston. Lizzie Fletcher,
Sylvia
District 7.
Garcia.
What's the matter with her?
Nancy, I'm glad you...
Garcia.
Nancy, you are doing God's work here. Thank you very much for pointing that out, my dear friend. And great hearing your voice. I got to go to another call because we're running out of time, Nancy, but thank you so kindly for calling in. Bye-bye. Let's go to Daniel, line 2. Come on in, Daniel.
I recently heard somebody from the radio that somebody had Medicare and they go to Medicare Advantage and you need to go and you want your Medicare supplement back and you can't do that because you have to go back to some qualifications or something.
Yes.
That's not true because I had my insurance agent that I met and he said I had Medicare supplement. I had a Medicare Advantage, and he's been my insurance agent for about 5 years.
Daniel,
and,
let me just stop you for a while there, okay? I don't know what your agent did, but that answer, and I want to make sure that everybody that's listening to me hear my voice. That is not correct. If you, let me explain. It was correct for you because of something that you went through. But here is the thing: you probably were still healthy, and you did get Medigap, but you had to requalify whether they told you or not. They went ahead and they pulled your history and realized you were not dying, so we will go ahead and give you the insurance. But for somebody, let's say somebody has prostate cancer while they are on Medicare Advantage and they decide to switch back to standard Medicare, they are having to go back through the authorization through the insurance companies, and then the government gives them the right, because you were previously in Medicare Advantage, they then have the right to charge you a premium or deny you service altogether. However, if you join Medicare immediately, right as soon as you turn 35, you don't have 65. You don't have that problem. But I got to go to Maggie, who's been thrown off several times. Sir, there's no debate. It's written in the law. Thank you. Go ahead, Maggie. Come on in, Maggie. Sorry that you had a problem. Come on in, Maggie. Maggie, you're on. Maggie, you're on. Oh, my God. Daniel, come on in. Daniel, are you hear me? Okay. All right. That's fine. We can't take any more calls. But let me tell you, please, what Daniel, that guy just said on that is patently, I don't know who is working. It's patently false.
Whoever his agent is
lied to him. They lied to him. We got to get out of here now. We only have a couple minutes or so. So, Cathy, give me a closer real quick.
All these attacks and the privatization of Medicare has been constant. It's increasing. We need to fight it, stop it. So that means writing Lizzie and all of your Congress reps to say you need to step up and stop this. The Biden administration from they could end it. Joe could end this whole scheming with these entities, because it's gone from 53 to 99 different programs. And the majority of us who belong to a church, a professional organization, a union, a charitable organization, those of us know that keeping traditional Medicare as the primary option and expanding it and improving it is the best way to cure this sick system.
Thank you very much, Cathy, for coming in. And I'm going to want you in here again. I'm going to want some others from your organizations in here. This is a service that we have to provide to our folks in Houston and around the country. Folks, I want to tell you this. Everything that I'm telling you here is actually true. Everything that I'm saying is factual. And if we ever make a mistake, we will tell you. Do I need to exit right now? Okay, my name is Egberto Willis. This is Politics Done Right. We'll do this again. You know how I end this, baby. I am what? Out! We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number 1, subscribe to our channel. And number 2, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.